You know, for a company similar to GE being in this region for more than 80 years, specifically in the UAE for more than 40 years, we use the Arab Health as a platform to launch our recent innovations, recent products innovations and introductions to the market. So for this year, we have more than 10 new products that we're launching in Arab Health. One of them, and the most important, is a mammography system, a new mammography system called the Senograph Pristina. What's special about this system is that we give control to the patient herself. A big statistics showed us that most of the ladies that doesn't or don't attend mammography scans is because of the uncomfort level that they undergo during the screening. And definitely for an earlier screening will result definitely in a better result. So we see a reduction of at least 25 to 30% in reduction in cancer later on if we start with early screening. So what we managed here is to give control to the patient herself, where she can increase or decrease the amount of pressure during the procedure, and definitely we believe this will encourage more and more ladies to undergo early screening in mammography. So a second very important introduction to the market, to the healthcare market, is the new MR system, Signa Architect. What's so special about the system is that it's first a wide bore instead of 60 centimeter bore, which can be a little bit difficult for patients that are claustrophobic. We're introducing a bigger bore, which is 70 centimeters, so more space for the patient in the tunnel, as well as the opportunity to scan the patient feet first or head first. So, for example, if you're scanning the lower abdomen, you don't need to take the patient fully in the tunnel, which might be cumbersome and annoying. So that's the second feature. A third very important feature is SignaWorks. This is a platform where lots of software and applications are being put that will help the doctors and the users to iterate and reconstruct images which in a faster way, which means a shorter scanning time for the patient. On the ultrasound, for example, we've introduced a new system as well that will allow you, in a very briefly, to have a 3D printing of the baby immediately after the ultrasound procedure. So these are like the top 4 out of the 10 introductions we have this year.